full. About over 70 people came out associated with the Glenroy Central, with the Good Start Early Learning Centre. All 70 of those who were tested yesterday have returned negative test results, and we have the pop-up site again active this morning at Oak Park to ensure that the remaining primary close contacts, about 20 people, also conclude their testing. But again, a positive step in the right direction. We've also listed Queen Victoria Market, the fruit and veg section we discussed yesterday, as a possible exposure site. We've identified around 100 primary close contacts. That includes 34 stallholders and around 72 people from a primary school in Ballarat who are on a school excursion trip to the market at the time on the Thursday in question. Again, all of those people have been tested. We are working through those test results from those cohorts. Again, my real thanks to all the stallholders and the management of Queen Victoria Market. I know this is not an easy time, as we have obviously a lot of business pressures in that area, but it's been good to get such swift response from the market and to ensure that we get people tested, that we can establish whether there's been any further on spread. We've obviously also seen an extensive deep clean of the market. I can confirm the market, within the current restrictions of our current lockdown, but the market is a safe place to access for those who are able to access it within their 5K limit for the designated purposes. We've also done some retesting of the original party, the 38 people who attended the private dining event on the 6th of February in Coburg. Those retests are going well. We test people a number of times. Well, obviously, as I've said many times before, all these people who are part of our investigation continue to isolate, even when they return a negative test result. And the retesting is also throwing up negative test results, which again is a positive and encouraging sign. Through the QR code system, and of course with 40 exposure sites, we really rely so heavily upon really good contact tracing systems at a whole range of venues, and particularly strong contact tracing systems at the 2 swimming pools that we've listed as exposure sites. We've identified over 400 close contacts through those swimming pools. A number of those are coming through our testing system. And again, I'd encourage people who have been to those swimming pools on the times and dates set out on our website. Please do come forward and let's get you tested today. Let's make sure we have a really comprehensive understanding of what may have happened in terms of any potential onward transmission from the 3-year-old who was in those swimming lessons. The classes most immediately associated with the positive case have tested negative, but again, we continue to search in case there's been any other potential spread. Yesterday I reported around 1,300, 1,400 primary close contacts. We now have I can now give you a better rundown of where we are with our current contacts list, and of course these numbers do fluctuate from day to day as we see the outbreak continue to develop. We have 59 household and social primary close contacts across the Holiday Inn cases. We have now 499 hotel quarantine staff and residents, all of whom are in isolation. We have 1,189 primary close contacts linked to the exposure sites, including the swimming pools and all the other public exposure sites that we've talked to in recent days, and 1,191 Terminal 4 passenger primary close contacts. All of those have been frequently messaged, and we are very aware of their status. I'm also pleased to confirm that 99% of new primary close contacts that we identified on the 12th of February were notified by our contact tracing teams within the 48-hour national benchmark. That's following a 99.8% figure the day before. So we're continuing to see really very high levels of follow-up by our contact tracing teams, and I'm so grateful to the teams for all the hard work that they are doing. And the percentage over the week is now 99.5%.